Emotional day at the State House as a bill to expand health care coverage in Idaho is dead for a second time. Up to 62,000 working Idahoans are believed to be in that gap population that earns too much to qualify for Medicaid but too little to qualify for insurance subsidies.
The Idaho health care plan would have provided coverage for roughly 35,000 of those people. 6 on Your Side's Capitol correspondent Marissa Morrison explains this is the second time this session the House refused to take a vote on the plan.
A bill that would have helped close the health care gap for Idahoans died its second death on the House floor Wednesday morning.
The floor for the second time this session, in what I feel was an act of profound cowardice, send the bill back to committee without being willing to even take a vote.
This is the second time this session the House Health and Welfare Committee moved to send the legislation to the floor for debate and a vote, and the second time it was returned to the committee without receiving either. The legislature has refused to address the so-called Medicaid gap population for nearly 6 years.
It was just kind of using their power for incumbency protection, protecting themselves from having to go on a record on a hard vote in an election year.
Advocates rallied in the Capitol last week calling for a vote on the Idaho health care plan.
If it's in the legislature's hands, it will be years and maybe never for this to be resolved.
A statewide petition is collecting signatures to put Medicaid expansion on the November general election ballot.
We have an issue that needs to be solved, and there was a solution on the table and they didn't take a vote.
With the Idaho health care plan dead for the session, it looks like the legislature is on track to adjourn by Friday. Reporting inside the State House, Marissa Morrison, 6 on Your Side.